What is a coronavirus? Coronaviruses are a large family of viruses that can cause respiratory illnesses such as the common cold, according to the Centers for Disease Control and Prevention (CDC). Most people get infected with coronaviruses at one point in their lives, but symptoms are typically mild to moderate. In some cases, the viruses can cause lower respiratory tract illnesses such as pneumonia and bronchitis. These viruses are common amongst animals worldwide, but only a handful of them are known to affect humans. Rarely, coronaviruses can evolve and spread from animals to humans. This is what happened with the coronaviruses known as the Middle East Respiratory Syndrome coronavirus (MERS-CoV) and the Severe Acute Respiratory Syndrome coronavirus (SARS-CoV), both of which are known to cause more severe symptoms. Where did the new coronavirus come from? Since the virus first popped up in Wuhan in people who had visited a local seafood and animal market called the Huanan Seafood Market, officials could only say it likely hopped from an animal to humans. In a new study, however, the researchers compared the 2019 nCoV genetic sequence with those in a library of viral sequences, and found that the most closely related viruses were two coronaviruses that originated in bats. Both of those coronaviruses shared 88% of their genetic sequence with that of 2019 nCoV. Based on these results, the authors said the 2019 nCoV likely originated in bats. However, no bats were sold at the Huanan Seafood Market, which suggests that another yet-to-be-identified animal acted as a stepping stone of sorts to transmit the virus to humans. A previous study suggested snakes, which were sold at the Huanan Seafood Market, as a possible source of 2019 nCoV. However, some experts have criticized the study, saying it's unclear if coronaviruses can infect snakes. World Health Organization's standard recommendations for the general public to reduce exposure to and transmission of a range of illnesses are as follows, which include hand and respiratory hygiene, and safe food practices. Frequently clean hands by using alcohol-based hand rub or soap and water. When coughing and sneezing, cover mouth and nose with flexed elbow or tissue. Throw tissue away immediately and wash hands. Avoid close contact with anyone who has fever and cough. If you have fever, cough and difficulty breathing, seek medical care early and share previous travel history with your health care provider. When visiting live markets in areas currently experiencing cases of novel coronavirus, avoid direct unprotected contact with live animals and surfaces in contact with animals. The consumption of raw or undercooked animal products should be avoided. Raw meat, milk or animal organs should be handled with care, to avoid cross-contamination with uncooked foods, as per good food safety practices.